Hello. This video is to explain the Employee Wellness Program offered to ORA from Rock Valley Health. In the video, my objectives will be to give you a background on Rock Valley Health as a company, an overview of the upcoming 2019 Wellness Program for ORA employees and spouses, walk you through the health screening process so that you know what to expect, highlight some upcoming dates and how to participate, and then mention some good-to-know information. Rock Valley Health is a division of Rock Valley Physical Therapy, and Rock Valley Health is a health and wellness team that has a number of disciplines. We have an occupational health physician, registered nurses, registered dietitian, health coaches, exercise specialists, physical therapists, and occupational therapists. My name's Jenny Tackett, and I am the registered dietitian with Rock Valley Health. We have a total of 44 clinics in Iowa and Illinois, and Rock Valley is truly a growing company that is patient-centered, therapist-led, and dedicated to improving the health of our Midwest communities. Here's a map showing that Rock Valley Health now serves over 2,000 employees through corporate wellness programs in 10 different states. The annual health screening for ORA is part of the 2019 program offerings and will launch your wellness program for the year. Employees and spouses who are enrolled in ORA's health plan who participate in the annual health screening can receive a discounted health insurance premium. The first step of the program is to complete a biometric screening. The biometric screening process will have 3 stations. First, when you come for your screening, you will sign a liability waiver and register for the process. Next, you will go to a phlebotomist who will do a venipuncture blood draw. And then you will go to a nurse who will obtain your blood pressure, your weight, body composition, and your waist measurement. For an accurate reading, we encourage you to fast for 12 hours, and that means no food or beverages except for water. We do recommend that you drink plenty of plain water to make sure that you're hydrated for the screening. If you are diabetic, on medication, pregnant, or have a medical condition that would prevent you from fasting for 12 hours, please follow your doctor's instructions regarding fasting, and you may need to call your physician's office for that information. If you are on medications, continue to take them the morning of your screening. Avoid using lotions and hand creams prior to the screenings, and empty your bladder prior to screening as well. The next step is to complete an online health risk assessment. The health risk assessment is like a survey to get a better view of what your habits are. We obtain your blood pressure, your weight, your waist circumference, and your labs, but we also want to know, do you exercise? Do you eat fruits and vegetables? What are your habits like? What is your stress level or your mental health as well? And so this is a very quick 10-minute survey that you will complete that will give us a bigger view of your overall health and help us make recommendations for improving your health if needed. Step 3 is a free follow-up consult to review your personal health report. And I strongly recommend that you make the appointment for the follow-up health report consult. This can either be on the phone or in person with a registered nurse, health coach, or registered dietitian such as myself. And for example, let's say just one of your labs was in a level that wasn't considered normal. During this time, we can give you recommendations to improve those labs. Screenings are very helpful in alerting you of some possible changes in your body that you may need to make some changes in your lifestyle habits. So please make sure to schedule that personal health report review. What we look at to determine if you are at high risk is whether or not you have metabolic syndrome risk factors. These are determined by the U.S. Department of Health and Human Services and the National Heart, Lung, and Blood Institute. There's a website here through the government that can give you more information on metabolic syndrome. What metabolic syndrome means is that you have risk factors that put you at higher risk for developing heart disease or diabetes. If you have 3 or more risk factors, then you are considered in the high risk category. These risk factors include your blood sugar. So a fasting blood sugar of 100 or more, or a non-fasting of 140 or more would be a risk factor. Your triglycerides are a fat that circulates in the blood, and that can indicate an increased risk for heart disease or diabetes as well. So a triglyceride of 150 or above. HDL of less than 40 for men or less than 50 for women. And this is what is often referred to as the good cholesterol. It's a lipoprotein that can be protective and protect your arteries from cholesterol buildup. If you happen to have an HDL cholesterol of 60 or higher, that will take away one of your other risk factors, and it reduces one risk count. So for example, if your triglycerides are elevated, but your HDL is 75, it takes away that risk factor. For blood pressure, ORA has set some more flexible blood pressure ranges than those outlined for metabolic syndrome criteria. So the guidelines for ORA employees and spouses are a blood pressure of 140 or above systolic and 90 or above for your diastolic blood pressure. If you have one of those or both, that counts as another risk factor. And then we look at waist circumference. So you will have your waist measured at your screening. A man with a waist of 40 inches or more and a woman with 35 inches or more will count as a risk factor. If you do not have a waist circumference, we look at BMI, and a BMI of 30 or higher is counted as a risk factor. Some of the program outcomes. What we want to do is give you an awareness of your health status. Sometimes people don't even know, what an appropriate waist circumference is or what their blood sugar or blood pressure is. So ORA is making sure that you are aware as an employee or employee spouse of your health status. We hope to increase health knowledge with educational opportunities, enhance your quality of life, reduce the risk of preventable diseases. So oftentimes when you have a slightly elevated blood sugar or blood pressure, you can make some lifestyle changes that can actually prevent the development of heart disease or diabetes, and then improve your lifestyle behaviors. There are 2 intervention programs offered to ORA employees and spouses based on your results. If you are in metabolic syndrome and you have 3 or more of the risk factors that were listed in the slide previous, then an 18-week wellness program is offered to both employees and employee spouses. This includes one-on-one sessions with me, the registered dietitian, along with weekly education through email. The emails will include videos that you can click on a link and watch information about things like dining out more healthfully or buying groceries in a healthy way. I will also meet one-on-one with you. I can do your weight, your blood pressure, and review food journals. The sessions can be conducted either on-site or on the telephone. For some spouses, telephone consults are the only option, but you're also offered an on-site session as well. These will be both at the Moline and the Bettendorf locations. ORA and spouses from last year had great results. 75% of those who participated got out of metabolic syndrome, so they reduced their risks enough to be in the low risk category. For those who use tobacco, a 4-week online tobacco cessation program is also offered. It is called Living Free, and it is truly a new way to quit. It's not about willpower. It's about a scientific approach to quitting that looks at how you're thinking about smoking or chewing tobacco. It includes 12 sessions. The first week is a 4-hour commitment, and then about 2 hours the 3 weeks after. And for smoking cessation, you truly are worth it. Whether it's chewing tobacco or smoking, it is a health risk, and we hope to offer you the resources that you need to stop that habit. Both of these programs are offered to employees and spouses. They're not required, but they do really help people get out of that higher risk category. So we encourage you to take advantage of these intervention programs. Some upcoming dates. Step 1 is the biometric screening. You can schedule an on-site screening when you get an email that will have links to schedule that appointment. The dates will be October 3rd and 12th in Bettendorf from 6 to 10 a.m. and then October 5th and 11th in Moline from 6 to 10 a.m. The next step, Rock Valley Health will send out an email so that you will have instructions to complete that survey or online health risk assessment. Then we will send out options for you to sign up for either an on-site or phone follow-up consult. And then starting in the new year in 2019, that 18-week intervention program for metabolic syndrome and the online tobacco cessation program will begin. Some good things to know. We want you to know that your personal health information is confidential and it's handled according to the HIPAA national privacy laws. It will not be shared with your employer. Informational materials will be distributed explaining the overview of the health screening along with instructions for participation. So we will keep you in the know. We'll send friendly reminders to all participants to make sure that you're taking advantage of the wellness program activities. If you have any questions, please feel free to call or email me. Again, my name is Jenny Tackett. I am the registered dietitian with Rock Valley Health. My number is 563-324-0008, or you can email me at Jenny, Jeni, .Tackett, Tackett, @rockvalleypt.com. Thank you so much for taking time to listen to this presentation, and have a great day.